So it's been a bit of a roller coaster over the last couple of days with this US trial results. Tell us what's come out of it.
Well, yesterday in the news, Astra put out a release globally which said that they got 79% efficacy in their American trial with no serious side effects and much to the relief of people around the world. Yet in an extraordinary move, and it is an extraordinary move, the US Monitoring Board, which is partly run, which is out of the National Institutes of Health and others, put a warning on Astra and asked them to clarify because they claimed that Astra was putting out out-of-date data and was misleading in terms of the efficacy rate, and claimed that they should have included patients afterwards, larger sample and a lower efficacy rate. Not hugely lower, but certainly lower. And this is not good. It's not good for a company to be not giving absolutely transparent results when there's so much vaccine hesitancy around. And Astra has form here. When they released the results of their first trials last year, they also misled in terms of what the results were. They conflated two trials which were not able to be brought together. We talked about this on the show at that time. One result was 62%, and the other was a very small group which got 90% efficacy, and they averaged the two and got 70%. It was not a reasonable average. The real result was 62%. And this is really unfortunate at a time when also they're still investigating the clot issue.
Which raises the obvious question, Norman, why? Why would the company feel the need to do this?
It beggars belief, and they were warned apparently by this. I mean, I'm going on reports, but yeah. But also I have just some backgrounding on this. They were warned beforehand that about this, and the committee was wanting these data, and Astra jumped the gun on the trial results. I have no idea why. Maybe they were trying to push emergency authorization in the United States and put pressure there. But the United States doesn't need the Astra vaccine. No. They've got plenty of Moderna and Pfizer and so on.
But Norman, just to your point that you made earlier, the difference in the efficacy between that result that they put out and then these disputed results, it isn't actually huge.
It's not huge, but it's round about what we know already, which is the high, low to high 60s is almost certainly the result. So when you're getting a 79% efficacy rate on the clinical trial, it's starting to look more like Moderna and Pfizer, and down at that other level, it's performing lower than many of the other vaccines. Still not, I still maintain that that's the only vaccine we had, we'd be okay with it, but it's not performing as well as the other vaccines, and I suspect there's pressure on them to show it's right up there.
Okay, we're taking this up further when we're joined next by John Skerritt of the Therapeutic Goods Administration. Let's talk about the local rollout, the locally made batches being given the tick of approval. How big a step forward, I guess, is this for Australia's fight against coronavirus?
Well, we've actually had a lot of doses around. I mean, a couple of weeks ago we had 1.3 million. We still only had 165,000 people immunised a couple of Fridays ago. It's going very slowly. There's been a lot of confusing communication. GPs are complaining they're not getting enough doses, and we're falling behind. I mean, just as a microcosm, the states are doing quite well, very well, in fact, with their rollout with healthcare workers and the 1As. But if you look beyond that, they're falling behind. So just as a microcosm, let's take Western Australia. To achieve the target of October immunisation, Western Australia has to immunise, I'm talking about population-wise, this is not a state government thing, 100,000 people a week. They're falling far behind that. So every week that they're not achieving 100,000, add on 80 or 90,000 to the following week, and then add on another 80 or 90,000 to the following week. There's a lot of catch-up to do, and they're not going to be able to do it through general practice. General practitioners are willing, but they've got to do their own job as well, looking after sick people. The GP respiratory clinics will step up to the mark. The state government is going to have to include the state government as a partner in this for mass rollout.
Norman Swan, thank you so much for joining us. Always appreciate your insights. Let's go now to John Skerritt from the Therapeutic Goods Administration. Thank you for joining us. So what do you make of these revelations? The US officials a bit cranky with AstraZeneca for, in their words, using outdated and potentially misleading data regarding this vaccine.
Good morning, Mike. Look, we're not particularly worried because by law we have to get a complete unredacted set of data. In fact, it's a contractual requirement when we approve the product. That'll come sometime during April. This was interim data that was released, so we will get the data warts and all. I would say what was released was encouraging, and in fact it was only for a vaccination gap of 4 weeks. And what's been found and what we're recommending in Australia is actually a 12-week vaccination gap. And with the 12-week vaccination gap, there isn't really a significant efficacy difference between the two vaccines we have.
In the words of one of the federal officials quoted in the Washington Post, that these misleading results or misleading data is the equivalent of, quote, telling your mother you got an A in a course when you got an A in the first quiz, but a C in the overall course. And just picking up what Norman Swan told us, this doesn't do well for well-placed efforts by the TGA, by other arms of the federal government to overcome that vaccine hesitancy in Australia.
Well, we'll get the whole course results. We will get hundreds, in fact, we'll probably get thousands of pages of data. I'm expecting not long after Easter. That will be the warts and all view, and we will publicly report our assessment of that data, and we'll see how it looks. We haven't seen the data the Americans are talking about, but we will get everything because, as I've said, they've made a legally binding commitment to do that when we approved the product.
Now, we understand the TGA had a big meeting last night concerning those concerns about blood clots and ties with the AstraZeneca vaccine, which European regulators have said yet no such link. What was the outcome of that meeting here, if that happened?
So this was a meeting with the TGA, the government's advisory group on immunisation. We also brought in a number of blood experts, clotting experts, haematologists. And they pored over the data in some detail. The meeting went well into the evening. And their conclusion essentially was, firstly, there's no evidence of cause and effect. Secondly, it is rare. There is, in a rare group of people, and 1 or 2 in a million. So again, your chance of winning lotto or the lottery is higher. But still, in that 1 or 2 in a million people who have certain conditions, such as a condition called HIT, you should talk with your doctor ahead of being vaccinated. But these are extremely rare cases. We've seen none of them in Australia. And there's no evidence that people with clotting problems writ large should be concerned about either vaccine.
Just about out of time, John Skerritt. Let's turn to the approval of the locally produced AstraZeneca vaccines. Obviously a big step forward for Australia's fight against the virus.
Yes, it is. 830,000 released, but they're getting on the trucks and planes as I speak to you. There will be more coming in every week. And really, the Australian manufacturer will be the backbone of the vaccine operation in the next few months. And so we're very fortunate the product is of equal quality to the global product.
John Skerritt from the TGA, thank you so much for joining us this morning.
Thank you, Mark.